starting tomorrow, when you put on your scrub tops and your scrub jacket, right, you have to follow these infection control procedures. Anytime you have to come to the GA lab, you will not be wearing your watches, you will not be wearing any type of bands on your wrist, and you will not be wearing any type of jewelry. So you will have to take off your earrings, take off your watches, take off your rings, and all of that stuff when you come to the GA lab. So tomorrow morning, when we come in here to start the performance check, I don't expect to see any of that stuff, okay? Right? Please look out for each other and remind each other. Please let your shipmate know before I see it if they may have forgot, right, to take out the earrings or something like that. When you take that stuff off, do not put it into your scrubs. Don't put it in that scrub jacket pocket. Put it in your pants pockets for your uniform, right? Because that's going to go with you. You make a mistake and put it in the scrubs, you're going to forget it. And then I'm going to be getting a call saying you need to come back and get it. So put it in your uniform pants, okay? So at the beginning of the day, I'm going to make sure I have all that stuff off. Proper engineering controls are utilized. And I'm going to wash my hands completely and thoroughly for how long? 1 minute, right? So I'll come in. I know your thing says 1 minute, 20 seconds, rinse 20 seconds. Just 1 minute. You're going to wash your hands for 1 minute, and then you're going to dry it. You're going to wash it, rinse it real good, and then you're going to dry it, right? So here, take my time. Usually there's a clock that was in here. Usually there was a clock on the wall and you could just time yourself using the clock because you're not going to have a watch on your wrist to time yourself. But just like HM2 said, you can sing the happy birthday song. You can, you know, whatever let you know that you have gotten to a minute, right? Okay, then I'm going to rinse. Then I'm going to dry. And then I'm going to don my PPE. And what order am I going to don my PPE?
Mask, eyebrow, washing.
Yeah. Y'all got it.
Say it with me. I will not go into the drawers with my gloves.
I'm not going to the drawers with my gloves.
You will not go into the drawers with your gloves because that is an infection control infraction. You do not go into drawers, even if you know they're clean. It doesn't matter. Nobody else knows that. You do not go into drawers with your gloves. Okay? So if you have any questions, you stop and say, do I want to go into a drawer? Do I have on gloves? Listen up. Take the gloves off. So, I got my mask. I got my eyewear. I'm gonna put on my gloves. I like to take an extra pair of gloves out, just in case the gloves that I have on rip or tear or something, right? I always take an extra pair out. So remember, do not go into drawers with your gloves. So I took my glove off because I know I'm about to go into something. Your Cavicide wipes and Cavi spray will be in drawer 13. And guess what? Now I don't have to go into anything because I already have extra gloves out, right? Save myself. So the first thing I want to do is I want to spray, right? Because it's spray, wipe, spray. You can be a little bit heavy on the first spray. sprayed. Now I'm gonna wipe. You want to wipe these hoses like all the way down. You don't want to kind of just do this. You got to wipe the hoses down as well. That's right in here. Make sure you don't take those parts off. That should be sitting firmly in place. Okay, y'all, what they doing ain't got nothing to do with y'all. What they doing ain't got nothing to do with y'all.
I'll do it. When you wipe down, is this also a time when you were on top of the boards? When you also like on top of the boards?
Yeah, so it's best for you to go ahead and untangle the cord while you're wiping down, right? You can do it then. You can do it before you set up, however you want to do it. But yes, it is big. I'm not doing it right now. You can go ahead and untangle it while you're wiping. Okay, so I wiped. Make sure you wipe thoroughly, and then you're going to spray one last time. Now remember when I said you do not want to spray so heavy that it's not dry by the time your patient gets there, right? So you want to slightly press on the handle and give it a light spray, right? Not a heavy spray, so just a little light. You don't want it soaked, right? If you find that it is soaked, just come back through with another cabbie wipe and wipe it again. and then let it dry. You don't want like it wet and your patient goes to sit down. So then you just, now you're done, right? You spray, you wipe, you spray, right? So now you want to purge your lines. And how long are you gonna purge again for?
1 minute.
All right. Patient two, see if that you can angle that clock up to lean against the TV. Right here. No, not that one. That clock. All right, yeah, we'll have it like that for tomorrow. There we go. Now, you're not just purging this lines. You have to purge these, and you have to purge your air water syringes, okay? So you'll do this for 1 minute, and then you'll do your air water syringes for 1 minute apiece. Go ahead and set up all day. Yeah. Thank you. Okay. So you see why you need a little water in here? Because I'm purging this for a minute. I'm purging those two for a minute. I'm using up a lot of water at the beginning of the day. All right. Okay, let's say I did that one. AC, you remember? Let's say I did that wrong. Okay, so we purged the water lines. Now I want to set up my barriers, right? I want to set up my bracket tray cover, my handpiece sleeves, my 3-way syringe sleeves, suction sleeves, headrest cover, right? Sticky barriers. They got all the particular barriers you're going to need to set up right here, right in a list. Main thing is to place your barriers on anything that you know, right, is going to need to be covered during patient care, where you can have splatter and all of that stuff, right? So like we talked about earlier, you'll have the tray cover for exams, but you'll use the blue wrap for actual appointments, right? When y'all are setting up for the barriers, I'm trying to see, I think I'm going to go ahead and have them put the HVE and the HVE, not the HVE, the air water syringe tips on there. Just like the two tips, one on. So when you're setting up, just make sure you put your air water syringe tips on. They're in drawer 3, right? And you'll need 2 of them. One for the bracket tray and one for the assistant side. So again, you don't have to wear gloves with your barriers. I know HM2 has his on.
Oh, because I'm going to touch the suction tip, that's why.
Oh yeah, so when you go into your drawer, right, you're kind of, I don't know, it might have been different for y'all. I don't know how y'all did in the clinic, but when we were setting up in the morning, we didn't Once we sprayed the room, we didn't use gloves. We just washed our hands after and then we set up.
Just for the, because I don't want to touch the suction tip, the HVE with my fingers.
Yeah. So usually how I would do it is I would grab it from the bottom. You never want to grab anything that you're going to be placing in the patient's mouth from where the patient actually puts their mouth. You grab it from the bottom. Just remember tomorrow, right? What you can do is you can grab the bottom of the HVE, and because they're kind of like combined, and take it out of the drawer with your non-glove hand, place it down for placement, right? And then when you get ready to actually place it on there and you think you're going to be grabbing on the tip, you can stick a glove on.
So she's talking about holding it from the bottom.
Like that, right? Bevel up is the top, and it's obvious on the slow section where the top is, right? Hold it from the bottom, and then if you want to stick a glove on when you're actually placing it into the suction, that is fine. But I need y'all to remember, you do not go into drawers with your gloves on. That is a no-no, right? So.
Hey, computer. So we have a meeting at 11.
Okay. It's
10.
okay.
We're going to be 219.
And what time? 2:19?
Yeah.
Okay, I'll be in there. I'm on my way. Okay. Let me finish it up somewhere. I'll walk up to this movie.
Yeah.
Okay, just know that the patient safety glasses and all that stuff you saw was on the tag. Tell them don't worry about the completed in 8 minutes portion.
Okay.
That doesn't. And tell them don't worry about that. And then Persian, and then and you don't have to actually demonstrate the spray right spray since they've already seen it and she already recorded it. You can just say at the end you're gonna do your spray right spray again. And then just returning the chair to the door position so they're secure for the day. And then you know how to remove the PPE and just unplugging electronics at the end of the day.
Got it. You got CSAT?
No,
Oh, no, you got turnover.
yeah, I'm gonna turn over stuff for his name. I'm gonna go tell engineer. Okay, sorry guys, I gotta go to this meeting real quick.
Repeat that again, sorry, I can't really hear. Yes, so when you spray right spray, the reason why you're taking your or putting gloves on for that, why do you think? The cavity wipes, okay? Because cavity wipes are really harsh on your skin, okay? Is everybody good back there? We need a break? Okay, because we don't have that much time, so we're just gonna finish this up. So basically, we need to cover all the spaces that we're gonna be touching. So we have barriers put in place. So if you notice, like I talked about before, we have our light switch, we have our dimming switch. I kind of covered it in one, so you feel free to do that. Then you have the handles. They have the handle barriers, but I never use those. You have that option, but your clinics, when you get there, may not have that option. So I like to just use barrier. And if, I don't know if you saw it. So when I do my barriers and stuff, I already kind of know how many I'm going to use. 1, 2, 3, 4, 5, and then a 6 on that side. So I'm going to go ahead and pull out maybe 3 or 4 or, you know, whatever, however many it takes. This is 4 right here. I don't want to take out too many because it's going to get all bunched up, but I'll just pre-fold it like that. Okay, this is kind of, we're trying to work efficiently here. Then you just pull it off and then you use it, okay? So you would just pull it off, use it here, pull it off, use it here, and then so on and so forth until all your things are covered. That way you're not you're not doing too much. You're not, wasting time. So that was actually 3. These ones aren't folded. So I would take out 3 and then pre-fold them, and then you could just throw them on there. And then for the last 2 things, the control panels, I would just pull out 3 and then cover 2 here and then 1 there. Make sense? So it's all about being efficient. So because these are all the same, you can just pull out 3 and then pre-roll it and then stick it on there. Otherwise, you have to do 1, pre-roll it, put it on there, come over here, grab your light switch handle ones, put those on. You're wasting time. Then if you look at the hand pieces, whatever procedure you're going to be doing, that's going to dictate what barriers you're putting on. So if I'm not going to be using all these hand pieces, hoses, I'm not going to cover all of them. Okay, that's just me personally. So if this one's not, if I know I'm only using, let's say the patient's coming in, they're just going to be using the slow speed, then I'm going to make sure that these are away, right? But I'm probably just going to cover this one because this is the one that's going to be grabbed. Now, if I'm not sure, the best thing to do is what?
Cover them all.
Cover them all, okay? If I'm not really sure, I'm not really confident with my doc, I'm new to the command, new to dental tech, I'm just gonna throw barriers on all of them, okay? Then I have over here, these ones are a must. You're gonna cover all of these, including this one. I know I didn't put a barrier on this one yet, but you're gonna cover all of them because you're gonna be grabbing all 3 of them at some point. And then you wanna make sure your headrest is covered. What else do we got on that book? Keyboard and mouse, yes. So you can throw a barrier tape on that. The only thing with that is it's kind of hard to type. They do have keyboard covers available, but it depends on what your supply has. So it really depends. Then you have your amalgamator, okay? You're only going to be covering what you're going to be touching. You go ahead and throw this on your control panel, like that. And you can do one like this, okay? Where you're going to be touching. Do it like that, okay? So when you lift it up, you're not touching all this other stuff, you know. You don't have to cover the whole dang thing in plastic, just the stuff that you're going to touch. You know you're going to touch. So lift that up, cool, put that in. You don't have to put barrier over this plastic portion. Keep no barrier on that, just boom, that's it. On your shield, okay? Just do it like that. Cool, it's wrapped. I know I'm gonna be touching this portion. Okay, I'm probably not gonna be going like this, so I don't need to wrap the whole thing. On your curing light, there's a sleeve. Should be a sleeve for it, and you just slip it over. Okay, put the barrier on top of that. Cool. Tracking everybody?
Yes.
All right. What else we got?
Yes. Patient arm. This is the arm patient chair position pad, and then the assistant chair levers.
Okay, so your assistant chair levers here. Okay, you can put one on there. It should be here, and your lever down below. Whatever you're going to be messing with and adjusting, I would just go ahead and put a barrier on there. Let's see. I don't want to keep wasting our tape, so I'm going to just vocalize it. Let's see. Carrying light, we covered that. Mouse, keyboard. Essentially, yes, you want everything covered. If you don't have a keyboard covered, go ahead and throw some barrier tape over that bad boy. Patient preparation. So now you're going to place the safety glass. Oh, sorry, you're going to cover it first. Safety glasses. They're up top. What else we got on there? Safety glasses. What else?
Patient napkin.
Patient napkin. What else?
Alligator clip.
Alligator. Okay. These are alligator clips. They look just like that. There you go. Just kidding. The guys don't know what that's from, huh? Where the guy, you don't know what that's from, huh? Makeup videos, right? Makeup tutorials, yeah. I don't be watching those, chill. My wife watches them. But anyway, so these are the alligator clips. They got little teeth on them. So these, you just go ahead and you can place it up here. You can pre-attach it if you want. Pull it up nicely. Okay, and then what else? iPro, what else? That's it? Cool. We got, okay, DTR setup, go ahead and you can one line that. We don't have to get it completed in 8 minutes. We're not going to time you. Properly dispose of sharp items. So sharp Where is it at?
On the wall.
It better be on the wall when you get to your clinic. It better be. Drain water, reservoir, and purge water line. So how do we do that? How do we do that though? What are we grabbing? On this side, what are we grabbing? You just grab all of them, right? Whatever ones you're going to use or whatever ones that were used, and then just purge them in the sink, okay? And what about this side? Where are we purging them?
In the HVE.
Cool. Remove your barriers. So you would take off all the, this is at the end we're talking about. This is breakdown. You remove your barriers, take everything off. You would have your dirty gloves on still. You just start taking everything off. Remove gloves, okay? And then you're gonna remove, or then you're gonna wash your hands, and then don new gloves, and then start doing your spray wipe spray, okay? Return chair to lowest position. How do we do that? There's 2 ways to do that. 3 ways to do that. Foot pedal. What else?
Control for the assistant or the provider.
Control assistant, control provider, okay? So wherever you're at, just go and hit that button. Just bring it back, okay? Bring that chair back. Patient should already be gone by now. And then return to the lowest position. Why would we not leave it in the position that it's at?
The hydraulics, you want it to be in a relaxed state so that you don't have stress on it.
That's a good point. You're really thinking outside the box. I'm thinking because the next patient, say it again, I'm sorry. Yes, the next patient that you bring in has to get in it. So if I had a tall patient that was able to just, get in and get out easily, but then I got a short patient come in or a child, and your chair is way up here, that's not gonna, then you gotta waste time to sit there and, hold on, right there, right by the door, and just lower it, okay? So by pre-setting it to the ground, now your patient come in and comfortably get in and out of the chair, okay? Next page. Remove amalgam trap and replace. Where's the amalgam trap at? That's your amalgam. That's your amalgam scrap container. But what about your trap? Not scrap. The trap is going to be here. Remember she took that out? Patient 2 took the cap off and then pulled that plastic thing out. That's where your trap is. You're going to replace that. Okay. You're typically not going to do it every single patient. You're going to do it at the end of the day. Just take that trap out. Or it depends on your patient load. If you only saw one patient, you could probably wait. The next day you see another 1 patient, you could probably wait and maybe do it at the end of the week. It depends on your patient load. But this is just for educational purposes, for infection control. Yes, you need to take that trap out and replace it with a new one. Cool. Remove all trash from DTR and replace liner. So trash is going to be found in those silver holes right there. The trash is going to be down the bottom. That's where you're going to throw it. To replace it, you just take it out. Okay. We do need to make sure that we're taking out the trash upon completion of our period of instruction. Okay, so we shouldn't be leaving this place dirty, because then the next class is going to come in here and then it's an issue. So okay, remove PPE. What's the acronym to remove the PPE? GEM. Okay, so gloves. You can go ahead and you can get your little thing, your antibacterial, your Purell, and then what is after gloves? iPro. Okay, take your iPro off, and then mask. Damn, good. Okay, cool. DTR breakdown. Oh, I'm sorry. Ensure all electrical equipment is turned off. So you would just come over here and you unplug everything and turn it off. Does everybody know where to turn off the amalgamator? Point to it, Shannon. You got this. Right there, okay? Wherever she just pointed, that's where it's at. You're just going to click it on or click it off. Okay? A side note, when it comes to safety and equipment checks and stuff, I know this is not infection control. This needs to have a third prong on it, okay? So it'll have 2 powers, and then it'll have your ground prong. If this is broken off, you will not use this, okay? So if you ever see it in around our areas and maybe the instructors missed it, do not plug it in with this ground prong missing. Why do people break these off? Does anybody know? These get broken off because a lot of outlets, especially overseas, there's only 2 prongs. there's no third prong, so then they break it off so that it'll fit. Typically microwaves, they'll do that for conventional ovens and stuff in your lounge. People will break these off so that it fits into the thing so they can use it. But what that does is there's no ground, the heat is then stored inside of the actual circuit, and then you can cause a fire. Okay, so make sure, you know, during your safety checks or whatever, it's just a side note, that you have, you know, see if you have 3 prongs, so you're good to go. Okay, obviously that's not it's not listed on your check sheet, so I'm not gonna like ask you, you know, did you look at this, but it's just something to keep in mind for your own safety and for your clinic's building safety. Any questions? You first.
So throughout the whole thing, like when you purge your water lines in
Yeah.
preparation, do you still keep your gloves on?
When you're purging water lines, do you keep your gloves on?
No, like preparation, because then you went to barrier replacement, and then you weren't wearing gloves, so do you take them off?
I went to what replacement? I'm sorry, the mask is like so.
Oh, so it's like when, you know how like you purge the water lines in preparation, and then you
Yes.
do like the bracket tray covered, do you take off your gloves, or you still keep them on? Throughout the whole, putting the sleeves on, into the.
If you already cleaned these and you have dirty gloves on, now you're cross contaminating. So if you've already sprayed and I mean you're probably not gonna have, or you put new gloves, clean gloves on. You're not gonna use the dirty gloves to clean everything and then touch these, because then these are now cross contaminated. See what I mean? Does that make sense? So just kind of make sense of it. If I'm breaking down, or if I'm setting up and I'm purging my water lines, everything's probably, you know, you haven't used it, so you can just purge it how you're gonna purge it. At the end of it, when you're starting to break down and everything, and you do your, if you haven't done your spray wipe spray yet, then I mean, you can grab these and purge them, but I would probably just take the gloves off and put new ones on. Just, you know, it depends. But looking at this, where do you have the question, in the preparation or in the breakdown?
Cause when you started putting the barrier placements, like when we came over here, you're not wearing gloves, so
Don't mind that.
Okay.
Don't mind that. I wasn't actually demonstrating like barrier placement, like how I was just putting it on so that way when she's done showing y'all, this was already set
so
up.
our gloves are still on then throughout the whole thing?
Yes.
Oh.
Yes. Does that make sense?
Yes.
So you were talking about when she was demoing, I was sitting over here behind the scenes.
Yes.
Don't worry
your
about
gloves
that.
weren't on, so I was like, do we put like sleeves and everything with our gloves on?
So don't pay attention to that. I wasn't demoing. I was just trying to
Okay.
make sure that the barriers were put in place, so that way when she was done, y'all could just turn over and all this stuff was already
Okay.
set up. Okay, don't get confused by that. That makes sense, everybody?
Yes, sir.
Okay, so with your barrier placement, though, HN2 did mention that you can put the barriers on without the gloves. She did mention that, right?
Mm-hmm.
Yeah, so you don't have to necessarily have gloves on. But I mean, if your gloves are clean and you haven't done anything, it's fine to use the gloves and put on the barriers. Just think about whether you're contaminated or not. Okay, so in preparation, it says to don appropriate PPE, so that's what you're gonna do. Don appropriate PPE, go ahead and purge your water lines, spray wipe spray, do all that stuff. In the barrier placement, those gloves are kind of still clean. I mean, all you did was set up. You didn't touch any patients, right? So you can continue placing your stuff on. Cool. Sorry, you had a question. Yes.
Are we gonna be able to practice this?
Yes.
Before?
Yes. Tomorrow. We're gonna get straight into it. Cool. Any other questions? Yes, Jen.
What order is it going in? Like equipment first? Then
Equipment first. Yeah. So you'll walk in. You'll do your check, your equipment check. Run through all the. You don't have to memorize everything. So you don't have to. We're not gonna be like, okay, step by step, run me through it. No. So we're probably gonna just throw it at you. Okay. So let's switch over that page real quick. So I'm gonna be like, okay, safety. So what are we checking for? And then you would just come in and be like, okay, H2, we're checking for frayed cords, making sure, you know, my electrical equipment is good. Okay, cool. I'm also checking for any defective plugs. Like I told you, the ground prong, but you know, this is my plug. Is there any water nearby? Okay, safety. Okay, just think, what's gonna what can harm me, and you're gonna go through it like that, and I'll be like, okay, dental chair, what are you looking for? And you're gonna try and run through all that stuff, and if you miss stuff, then we'll try and get you to think about what you missed. Okay, so this is not a
It's in the stop and think thing, like, if you do it, the stop and think, if you do it, do you fail?
no. This is a we're trying to get you in the mindset of what you need to be thinking about. But if we just tell you and you don't actually do it, then how are you supposed to apply it? So this is your app. This is your practical application portion tomorrow. So you can come in, like I said, and we're gonna get to it. Not expecting you to memorize all this stuff. And for infection control, same thing. It's a lot on there. Not expecting you to. Now, I will tell you, if you like critically miss a step, let's say you put on your gloves first, I'm just gonna stop you and be like, okay, start over. And you put on your gloves first again, I'm gonna say, okay, stop, start over again. So that would be considered kind of like your failure portion. Like, stop and think about what you're doing. I'm not just gonna tell you, okay, you need to put on your mask first. I'm not gonna tell you that. So just, I guess it would be kind of like a stopping thing, but it's not like I'm just gonna put a red X and kick you out the room. We're gonna walk you through it. Any other questions? These are really good. No, okay. You could probably cut it there.